Hey guys, in this video we're going to go over what makes Gonstead different than say other techniques or other chiropractors you might have been to. It's a question we get asked a lot. So chiropractors have one job. We're to detect and correct what we call vertebral subluxations. And to make that real simple, that's when the joints of the spine get damaged, misaligned, and put pressure or irritate nerves. So our job, every time we see somebody, before we give an adjustment, we should find where these are in the patient. So most offices don't do a lot of analysis to determine where these are. So maybe they palpate a little bit, meaning they just feel the spine, or maybe they don't do anything and they just go in and deliver manipulations. Well, in the Gonstead method, we use at least 5 different criteria to determine what segments need to be adjusted before we ever touch anybody. So today, we're going to go over what our exam consists of. So the first part of our exam is going to be simply visualization. So when I look at a patient, okay, just looking at the skin can tell us a lot. So I look for different contours, asymmetries, areas that may be red or something that kind of jumps out at us. So also when we start touching the spine, things will start getting red. If there's inflammation in the spine, it's going to show up. Okay, so when I go through and palpate the spine as much as we do, we take a moment to look at the spine and see what stays red, what maybe goes away, and that gives a big window into maybe where the problems are in the spine. So once we do that, we're going to use an instrument. Now we're about the only ones in chiropractic that you'll see use this. It's an old instrument and there's newer versions of it, but this one works really good. And basically it's just a real sensitive thermometer. It's going to check temperature on both sides of the spine at the same time. And what that's telling us is that when the nerves are normal, they're controlling the blood supply to the skin. There should be equal blood flow, equal tone. But when we get a damaged segment and an irritated nerve, you're actually going to get 2 things that will occur. One is the diameter of the blood vessels to the skin will actually change, so you get a difference in blood flow from side to side. Also, you also get subtle tissue changes, meaning it might be less firm, kind of more squishy or soggy than the other side. And those 2 things combined will cause a temperature differential that we can pick up. And we use a special type of analysis called break analysis to determine exactly where these things are. And it, done right, it's very accurate and it correlates very highly with what we find with our hands. So after I use the scope, I'll come in and I'll feel every joint of the spine first softly, which is called static palpation. I'll just run my fingers down every single segment. And that'll tell me kind of just what the tissues feel like, and I'm looking for one that feels different than the rest. And we know it as what we call the boggy, swollen feeling. And that's really correlated with where the problems are. And then after that, we'll use motion palpation to determine which ones are fixated. Because when you get these damages, those segments of the spine become stuck. And that's the main problem. And that's why chiropractors adjust, is we're actually trying to restore motion and function to these segments. So after that, when I've done all this and determined, okay, I've got some spots to work on, then we use x-ray analysis to determine the best way to correct it. Because if the segment's misaligned, say, out to the right, if I don't know what that segment's doing and I push it further that direction, you're causing more trauma. So in the Gonstead method, we don't want to do, we want to do at least the amount of trauma as possible. So we want to be extremely precise in our corrections. So let me show you what that looks like. So first I'm just going to gently feel the entire spine, just to get an idea if there's anything that jumps out at me ahead of time. And then I'm going to use my instrument. We're going to check it from head all the way down. So I'll run it nice and slow, all the way up. And I'm observing the way the needle's moving. And it's not that it just moves, it's got to move in a very specific way. We're starting to see something that looks like one right there. And sometimes they're really small. The size of the needle swing doesn't make any difference. It's just how it swings, right? There, it goes over and back. So imagine that's the inflamed nerve. It's swinging over and back, right over that nerve. So it's subtle, but it's going like that. So that's what we call break and I mark it right there. Then I continue on down the spine. there's another one right there. And we'll check the bottom part. And that one's more pronounced. You can see how it swings way over when we get down there. Right there. So that's what we're looking for. So I found 3 separate readings on her. So now we'll go in and we'll do more palpation to determine exactly which segment's the one we want to adjust. So I'm feeling more for that swelling, just kind of feeling the difference in tissue. That one right there's got a lot more swelling underneath, and to her it's probably a little tender. And then we'll go in and we'll kind of motion palpate, meaning moving the segment to see if it's fixated or it's stuck. So when I check the segments around it, we got decent motion till we get to there, and that definitely doesn't move as good as the ones above and below it. So that's what we're looking for. So then I'll go ahead and I'll mark that. And moving on down to the next one, same deal. There's swelling right there. That's a little tender. And this area here is a little harder to motion, but we can bend her side to side, kind of feel how that's moving compared to the other segments. And sometimes you can visualize it too. You just kind of bend the patient and you should see a nice flowing arc. And when it's stuck, sometimes you won't. So she doesn't bend quite as good that way as she does the other way. And down here we go. That one's quite swollen. And we'll rock back and forth, just checking that motion. Yeah, that doesn't move. So we'll reach, and it's a little fixated on her. That's the one that's got the pressure. Okay, so we've identified those 3 that we would like to adjust. So then I would look at the x-ray and go, okay, I know exactly how that vertebra is rotated. So then I would take her to the appropriate table and we give a specific chiropractic adjustment to correct it. Okay, so that's what we do, guys. That's what makes us different. And what's unique about us is I'm going to do this every single time I ever see somebody, not just the first visit where you get an exam at somebody's office and then the rest of the time they just kind of move bones. But every single time a Gonstead chiropractor checks someone, we're going to do this exam. That's why the results are very predictable and reproducible amongst us Gonstead practitioners. So I hope that was informative, guys, because I know a lot of people don't know what it means to be a Gonstead doctor or why there's a difference, so why you should give them a shot. But anyway, that's what we do. I hope that made sense.